Hey everyone, welcome to my channel. My name is Natalie, and today we're going to be talking about the generalized concept of so you want to be a nurse. And I think it's something that I really wanted to talk about because I know that there's a lot of people who might want to be a nurse and come into the nursing field, whether they think that it's a glamorous career, or maybe they had a relative or a friend that was a nurse or is a nurse and they want to get into the field. I think it's very important for people to know what nursing really is, because it really is very hard to understand the determination, the dedication, the compassion, the love, the whole idea of what a nurse really is until you're already in nursing school or practicing as a nurse. So I kind of wanted to make this video because I think there's people out there that really want to be a nurse, but may not know all of what a nurse is, what goes into it, the dedication and preparation during nursing school as a nurse, and things that maybe you guys don't realize that nurses do, or that or tasks that they do. So I kind of want to make this video to help people either pursue their career or maybe think, oh wow, that's really not for me, because it would really kind of suck to spend all that time, money, dedication, and it's really stressful to kind of, so if you started, it would give you a lot of stress to only to find out that this really isn't for you. And that's totally okay if it's not, but just the fact that you're thinking about becoming a nurse is a wonderful thing, and it's a very, very rewarding career. So if it is something that you really want to do, I strongly recommend that you do it, because it's wonderful, it's great, it's very stable, you get good money, you get to meet a lot of people, it's very, it's one of the most trusted professions that we have. So I'm going to basically talk about what a nurse entails, how nursing school is. So if it's something that you think that you can stay dedicated to and commit to, then you guys should do nursing. And if maybe this is not something for you, maybe it's time to think of another career. So I'm going to go ahead and get started. So I kind of want to talk about nursing school first, because if you don't think that you're going to be able to get through nursing school, then there's really no point to kind of get past that. So we'll start with that. When you're in nursing school, this is a very different type of degree where there's a lot of dedication and a lot of sacrifices and a lot of studying. Not that there aren't any, not that the other degrees don't have those qualities, but nursing is very different in the types of questions and the types of tests and the types of application that you're going to be doing. So first off, you're going to be studying a whole lot, because this is not the type of degree that you can study the night before and then get an A on the next day. That's just not how it works. You need to know that information to be able to apply it into a scenario. So if you don't know the original information, there's no way you're going to be able to apply it. So that's one thing. There's a lot of time management. You're going to be doing classes, clinicals, labs, any outside simulations, any extra studying, projects. There's a lot that goes into it. So if you don't have time management skills, or you aren't willing to develop them, that's something that I would stop and think, okay, maybe I need to change my mind a little bit. There's a lot of sacrifice. You can't just go out every weekend and have fun and party and whatever you think. This is a very dedicated career, a very dedicated program that you need to understand that you're not going to be able to just do whatever you want, whenever you want. And if you're not willing to do that, then again, I would stay cautious and really, really think about it. So that's kind of nursing school in terms of classes. Still, while you're in nursing school, you're going to have to do a lot of clinicals, and you may have clinicals in places that you really want to be in, and then you may have clinicals that you really don't particularly want to be in. You may have a day shift, you may have a night shift. If a possibility that you might get a night shift, if that's not something that you're willing to do, or maybe that you cannot do at this time, I would think about it. There's going to be a lot of times when you have really wonderful days at clinical and you have the best patients that really appreciate you and love you and know that even though you are a student, that you're really there to take care of them and they really appreciate it. And then there are times when you have patients that really want nothing to do with you, don't really care that you're helping with them, might actually even be not the nicest to you. If that's something that worries you, again, I would stay caution, because you really have to keep up a front the whole time. You can't start, yelling at your patients or get aggravated with them or kind of retaliate to how they're treating you. You really need to keep your composure and understand that not all the time are they really mad at you. It's just because they're in, the hospital or in the doctor's office or whatever, and nobody wants to be in that situation. So if that's not something that you think you can control yourself or control your behavior while you're dealing with patients, again, stay caution. Also, it's not just the patients that you're dealing with, you are dealing with family members. And although you may say, well, they're not my patients, but you have to provide patient-centered care and family-centered care. And as much as the patient is yours, their family is indirectly your patient too, because they are there for the well-being of your patient, and you have to take care of their needs pretty much almost as much as your patient's needs. If you don't feel like you can deal with families, because not all the time are they nice as well, because of course their family member, their loved one is in the hospital, and of course they're not going to be happy about it. So there might be times when they explode or they get nasty or, whatever it may be. And you need to understand that it's not necessarily because of you, but because, their loved one is in there. But if that's not something that you think you can handle, or you bring that stress home with you, or you really can't leave it at the workplace or understand that, they're not directing it towards you, again, I would take some caution. Now, I'm going to talk about traits of a nurse. So you have to have a lot of compassion. You have to be a people person. If you are not a people person, I would suggest don't even bother, because you are dealing with your patients, doctors, staff, family. You are dealing with people all of the time. And if you're kind of more of a person that likes to do their own thing, doesn't like to really be bothered, or maybe would prefer to work in like a lab or something like that, where you're kind of working with your, organisms or microorganisms or whatever, I would definitely stay away from nursing. Although there are different, fields within the nursing career, like maybe you prefer to work in a doctor's office versus in the hospital, but whatever it is, you are working with people, you're working with patients, you're working with people that have emotions, and that's something that you're going to have to really be aware of. While you're a nurse, you are not just a nurse. You are a friend, you are a mentor, you are a teacher, you're an advocate, you're a supporter. You are more than just an individual that gives your patient medications and then says bye. You are there for them to be their voice. You are there for them to be a person that they can vent to, that they can cry to, someone that they can really trust. And you have to have those qualities of compassion and love and empathy so that you and your patient connect very well. If you're not a people person, or you really have trouble kind of seeing the other person's point of view, or you just don't really want to deal with that, again, nursing may not be for you. As far as, that's kind of done with qualities. As far as when you're in clinical, when you are an actual nurse, you have to deal with bodily fluids, okay? You have to deal with smells. You have to deal with shots and needles. And a lot of people think, oh, nurses don't deal with the, like poop or urine or anything like that. You are not above the CNA. Do you hear what I'm saying? You are not above them. You can't just say, oh, the CNA will take care of it. You are not above the bodily fluids, okay? You are there. The CNA is there to help you. And sometimes you might need to delegate to them to do certain things like that. But you are there for the patient and all of the patient, no matter what their needs are, okay? So if you don't think that you can deal with blood, defecation, vomiting, sweat, whatever it may be, I would think about it. A lot of people, like for me, sometimes smells are very hard to deal with. But over time, you do get used to it, but some people really can't tolerate it. And maybe you might not want to be in the hospital. Maybe you prefer to be outpatient because you probably won't have to deal with that. But I would just stay cautious if that's something that you really can't deal with. One other aspect that you do have to take into consideration, whether you're in clinical or you start your new nursing career, are other nurses. And what I mean by that is that there are a lot of, in the nursing career, there are known to be nurses that eat their young. So basically what that means is they see a new nurse come in, you don't really know what you're doing because, you're not supposed to. And they don't really want to deal with teaching you, or they kind of think, oh, how do you not know how to do this? It's like, I'm new, I don't know really what to do anything, especially not on this floor. I don't know the policies yet. And a lot of nurses, older nurses, don't really want to deal with that and may criticize you, or sometimes it's almost like a bullying situation. And that's going to probably happen for a long period of time, and it's definitely up to the new upcoming nurses to kind of stop that cycle and remember where you came from. Once you become a nurse for a long period of time, remember to give back to those new nurses because you were there once, okay? And you need to understand that they're learning and that they're grasping concepts, and it's not going to be as quick because if someone's been a nurse for 15 plus years, of course they're going to know pretty much everything, especially if they were on the same floor all of their career. So just remember that you might deal with that. It's very important to talk to the nurse if you are experiencing that, saying, hey, I'm really kind of feeling like I'm not getting treated correctly. Can we please talk about it? And remember that if it doesn't go well, or if it doesn't resonate with the nurse, maybe you need to talk to your nurse manager. But realize that that's something that you're probably going to have to deal with at some point. Some people probably never have to deal with it, and that's wonderful. But most people, I believe, do at some point, whether you're in clinical or whether you're on the field. So just be aware of that. Stand up for yourself because you are new and you're learning, and that's what you're there for, is to learn. But just be aware that that can happen. So if you're really not ready to deal with that, maybe I would take some time or do maybe like retail or something where you can learn how to deal with individuals, and then maybe try it again if that's kind of the only thing stopping you. Again, this also depends on the setting that you're in, whether you're in the ICU, emergency room, med-surg floor, labor and delivery, whatever it is. If you can't deal with wounds or people coming in a little, coming in a little bit crazy, I guess you can say, if you really can't deal with that emotionally and know different coping skills, ways to kind of keep work at work and not bring it home with you, I really take some caution in becoming a nurse, because that is something that you're gonna have to deal with no matter kind of what floor you're in. You just never know. You're dealing with people with emotions who have a lot of worries or anything like that, so it's just better to take caution with that. And my purpose with this video is not to scare anyone away from nursing, because nursing is one of the best jobs out there. It really is. It's very rewarding. If you really like to deal with people, it's so nice to meet new people, to have that satisfaction to help them. Sometimes they even help you. Sometimes they even teach you a lot more than you could ever think that you would know. It's a beautiful, beautiful, beautiful career to be in. It's just wonderful. It's the most trusted profession that we have, and that's why a lot of people want to be a nurse. But a lot of people don't realize the time it takes, the sacrifice, the dedication to become a nurse. And some people are willing to go through all of this, and other people are really not willing to do so. So I think it's best to know ahead of time, before you spend all that time, money, and sacrifice, do I really, really want to be a nurse? And if it turns out that you don't, that's totally fine. If you still want to be in the healthcare field, there are tons more opportunities that you can do that are people related or more behind the scenes or anything like that. So you just have to do a little bit more research. However, if you do want to be a nurse, it is a wonderful career. I really strongly recommend that you do it, because I think it would be worth it in the end. So thank you so much for watching. If you guys have any questions, please go ahead and leave a comment down below. Please remember to subscribe and hit that little button. And thank you guys for watching. I hope you guys have a wonderful day, night, afternoon, whatever it may be. And remember to always believe in yourself. And if you do choose a career path of nursing, I wish you all the luck. Thank you guys so much. Have a good one.